In this section, we will cover the hoist slings, different types, and what to look out for. As you can see, SJ is holding a full-body hoist. There are 3 types of things to look out for when handling with any hoist sling. This is before even placing it on a patient or resident. This includes the sling specifications. There are different specifications labeled on a sling, such as its size, type of sling depending on manufacturer, and weight it can handle. Bear in mind, sling specifications may also include the color instead of sling type. Different colors dictate the weight usage of the sling in use. There may also be a lifting sling inspection tag for when it was last inspected and whether or not it is available to be used due to its last date being expired and needing another inspection. Question 1 for those in manual handling training. What are the 3 things that are commonly found on the hoist sling tag? The next thing after checking if the sling is the correct one for the patient resident is to check if there are any tears, rips or holes in the fabric, and if the sling loops have any signs of fraying or damage. Ensure that the sling is in excellent condition before using, and do not use if it is in less than great quality. Ensure that the patient's risk assessment is up to date and risks are fully identified. Have the patient's needs changed? Has their condition deteriorated? If so, don't use the sling. This will be how a full-body hoist sling will look like when properly applied to a patient. If a patient requires a full-body hoist sling at all times, you can leave it on them depending on company policy. The reason for this is due to their condition, and that trying to apply any other sling may cause injury or pain to a resident. Please do not misuse the slings when a resident is not assessed for it. Ask your nurse or senior before using a sling that has not been used on a resident, and they will assess them. Question 2. What must you look out for on a sling and its loops before using it on a patient? This is a second type of hoist sling. This is called a toileting sling. A toileting sling is differentiated by its lower back side having no fabric and its legs separated by a wide gap on both sides. Toileting slings will also have specification tags and inspection tags to ensure that they are fully safe to use and inspected by the correct authority. Again, the 3 most common types of specifications you will see on these tags are size, manufactured type, and the weight load that they can handle. Some toileting slings come with a belt to ensure the resident or patient is safe and secured onto the sling when transferring with a hoist. This particular toilet sling's arms have padding between the middle and the arm hoops. This means that the arms must go underneath the resident's arms. And for the legs, they must be hooked underneath the resident's legs, creating a hole between the 2 side loops to enable them to be able to use the toilet or commode when transferred via hoist and seated. This concludes Section 2 of Manual Handling Training, Hoist Slings. Please have a few minutes to discuss with each other or with the trainer if you'd like to watch it again. Please feel free to make notes, as this will come up in the 15-minute test paper at the end of this session.